So there's no evidence that supplementation will reduce the risk of cancer, and they do not replace a healthy and varied diet. The main reason that supplements are not beneficial in reducing cancer risk is because we actually don't know what part of a healthy diet is anti-cancer or has those health benefits. So the sugar and cancer myth is the most common one. I think I get it on a daily basis. The short answer is no. And there can be quite serious implications with following such a restrictive diet. When people refer to this myth, they tend to be talking about table sugar or white sugar, donuts, lollies, chocolate, that type of thing. But actually, there are lots of foods that contain sugars, whether they're natural or added. And pretty much all of our food that we eat is broken down into sugar by our body because that is the main fuel source for our body. That's what our body and our brain prefers to use. So it tries to break down everything that it can to turn into sugar. It also happens to be the main fuel source for cancer, hence why cancer likes to use it as much as our body does. But the cancer actually won't differentiate between sugar that's been made from a donut to sugar that's come from lentils. As a compound, they end up looking the exact same on the inside from a chemistry point of view. Cancer can actually use other fuel sources such as fat and protein. It just doesn't like to. So if there is sugar available, it will always use that first. The consequence of having a restrictive diet where you're cutting out large food groups means that you're not starving the cancer, you're actually starving yourself. So the cancer will actually take what nutrients it needs. It's a bit of a bully, and kind of whatever is left over, your body will be able to have. And if there's nothing left over, then there's nothing left for your body to use. What then happens is that your body then starts to break down your muscles and fat. That's when you start to lose weight, and it will use that as the fuel source. So it essentially starts almost eating itself. I guess on the other side, having excessive sugar intake does not mean that your cancer will grow faster or bigger than, say, it would have if you didn't. The growth of your cancer depends purely on what type of cancer you have and what stage your cancer is at. A lot of my patients who do follow this diet have quite excessive weight loss in quite short periods of time. They're quite fatigued and quite unwell. We are so conscious about people maintaining their weight because when you lose large amounts of weight, your tolerance level to your treatment, so your chemotherapy or your radiation, is reduced quite substantially. So those side effects that are quite common tend to be exacerbated quite heavily, which then also in turn impacts how much you're able to eat as well. So it can be quite a vicious cycle. In terms of the amount of sugar that we should be eating, Australia doesn't have any guidelines in terms of how much they recommend. Reducing how much added sugar is in your diet, so in terms of sugar that you might add to tea or cereals or foods that have added sugar into them. For general healthy eating, we do recommend reducing those foods as much as possible and focusing on a varied healthy diet of whole grains and fruits and vegetables.
So in terms of with artificial sweeteners, there's no clear or consistent evidence to show that it's associated with cancer. Because artificial sweeteners are so much sweeter than normal table sugar, so some artificial sweeteners are up to 200 to 20,000 times sweeter, we don't eat it in the amounts that it can become toxic to us. Artificial sweeteners can actually be beneficial for some patient groups, so patients who have diabetes, for example, to help with their blood sugar level control, because we know that high or elevated blood sugar levels can actually impair or delay wound healing and recovery. or even for our overweight and obese patients as well. So with those patients, if they want to substitute, for example, their regular soft drinks for diet soft drinks, which are artificially sweetened, that can actually help reduce quite dramatically the calories that they're consuming, which in turn can help them reduce their weight, which in turn helps reduce their risk of cancer altogether. So again, with organic foods, there's currently no strong evidence to show that organic foods have higher cancer fighting potential than our conventional fruit and vegetables. There was a large study that was done in France about 2 years ago that asked patients who had organic food versus conventional foods around the development of their cancers and also their risk of their cancers. They found that yes, the patients who did eat organic foods did have a reduced risk, but it wasn't a direct cause. So they found that patients who did consume organic foods tended to have more healthy lifestyles. So they tended to eat more fruits and vegetables, engaged in more physical activity, didn't drink as much, were not smoking. So cancer did still develop in patients who did eat organic food. The main takeaway message is eating your fruits and vegetables, whether you choose it to be organic or conventional, is the way to go. So the current studies investigating drinking water and bladder cancer, there's inconsistent evidence or studies that were not statistically significant to associate observed total fluid intake. However, the types of fluids such as soft drink or alcohol were risk factors of bladder cancer. From a biological point of view, decreased fluid intake could result in a greater concentration of carcinogens in the urine or prolonged time where cancer cells can stay in the bladder. So low fluid intake can inhibit, toxins from being flushed out. So it is safe to recommend that consuming enough fluid, so as per the dietary recommendations, is the best bet for preventing cancer. In terms of with filtered water, there's also strong evidence that water that's contaminated with arsenic can increase a risk of bladder cancer. Water can be contaminated through natural deposits from the earth or from agricultural or industrial runoffs. As I mentioned earlier, in Australia we're very lucky that we've got really stringent laws in terms of our water quality. So drinking straight from the tap is absolutely fine, but if you prefer the taste of filter water, then by all means that's okay as well. As part of, with healthy eating, there's a lot of emerging evidence to promote that Mediterranean style of eating. So the original Mediterranean diet include things like fruits and vegetables, whole grains, but also the inclusion of red wines. So red wines are quite high in things like anthocyanins and flavonoids, which are and have antioxidant properties. So enjoying, a glass or two of red wine responsibly, so with meals, is okay, but definitely not drinking in excess or having, alcohol mixed in things like cocktails where there's a lot of added sugar into it. The guidelines recommends that for healthy adults, the safest kind of recommendation for alcohol is no alcohol at all, because alcohol does affect people in different ways. But if you are going to enjoy, a glass of red wine, the recommendation is no more than 4 standard drinks per sitting to reduce any risk of alcohol-related harm, and then no more than 10 standard drinks for the week. So vitamin C is an antioxidant that's mainly found in your fruits and vegetables. It has generally been known to prevent DNA damage and therefore blocking the initiation of the formation of cancers, but not when the patient already has the diagnosis. It is a water-soluble vitamin, so similar to what Alana mentioned previously, if you're consuming consuming it in excess, then your body will naturally excrete it. As mentioned previously, so in terms of the use of supplements, we generally don't recommend patients to consume additional supplements if they're not shown to have a detected deficiency, but instead with vitamin C, trying to get it from diet alone. So having your 2 serves of fruit a day and your 5 serves of vegetables. The more colours you incorporate, the better, because with fruits and vegetables, the different colours have their own nutritional benefits and their properties. So eating a varied diet, again, is the way to go. In terms of with the use of cranberry tablets or juice or powders, they're still very early studies. So a lot of the studies around the use of cranberry products has been focused mainly on rat models or in animal models, not so much in humans. The reason why cranberry products are of interest is because of its anti-inflammatory properties. But again, similarly to vitamin C, cranberries are actually a really good source of vitamin C. So if you can aim to eat the rainbow instead of supplementing with isolated vitamins and minerals, because again, when you eat the whole food in its whole food matrix, so mixed with the water and the fibre and everything else in part of that food component, it's better absorbed. If patients do decide to engage in these complementary or alternative therapies, it is recommended that they do discuss this with their oncology professional, because sometimes it can interact with some of their medications as well.